You're now using Module 1, the overview of people-centered screening and assessment. In this module, participants will be able to explore and affirm best practices, to discover person-centered strategies to strengthen service delivery using screening and assessment, to increase their understanding of the purpose and intent of 5 home visiting screening and assessment tools, and to develop a supervisor's action plan for effective screening and assessment. Before getting started, it's important to understand your own perceptions about screening and assessment. So, take a look at this pop quiz and see what you think. Screening and assessment is A, a necessary evil, B, an interruption to the good stuff, C, a time burden, D, a critical aspect of culturally responsive and individualized service delivery, E, all of the above, and F, none of the above. At the end of this module, our work is to help make sure that the series of modules support participants' understanding of how screening and assessment done in a people-centered way can be a critical aspect of culturally responsive and individualized service delivery. Some important principles to keep in mind when doing screening and assessment come from learnings that have been supported through research and practice around motivational interviewing. So while this isn't a module that's a full-blown training on motivational interviewing, there are lessons learned that will be applicable. So we'll be considering motivational interviewing spirit and motivational interviewing adherence screening and assessment practices. A key component of MI Spirit is that professionals or practitioners convey the message of acceptance to people who are participating in services. So you'll note that in order to send the message of acceptance and to create meaningful rapport and a strong working alliance with participants in services, there are 4 critical elements. One is to send the message that as a professional you understand the absolute worth of the person that you're working with, that belief in their worth and their dignity is unconditional, and that no response they convey is going to diminish your willingness and acceptance to work with them within the scope of your practice. Another core component is autonomy. That idea that you respect their ability to make choices about how it is they approach issues, concerns, and strengths in their own life. And conveying the message that they have what it takes to address the things that are important to them or to learn the skills to address the things that are important to them. Another core component is to convey accurate empathy. And this really gets at a home visitor or professional's ability to understand the worldview or attempt to understand the worldview accurately of the person who they're working with. Finally, in terms of acceptance, another core component is affirmation. That ability to let participants in services know that not only do you see their absolute worth, not only do you believe in their ability to be in the driver's seat of their own lives, and not only are you endeavoring to understand their point of view, that you find value and that you find something positive that you're able to give voice to in order to let people know that you're experiencing them in this way and that they're accepted. For more information about acceptance and a person-centered approach to delivering services, you can read Miller and Rolnick's Motivational Interviewing, Helping People Change from 2013. Conversely to an attitude of acceptance, practitioners can fall into the place of sending messages of rejection, and there are similarly 4 components that can convey that message. The first is judgment. So when participants in services believe that they must communicate or address content in a way that is trying to please a professional, that's highly problematic, and that comes from a place of concern about being judged and having services be contingent upon being pleasing to the service provider. There's also more overt judgments that are those less subtle power dynamics, but are overt criticisms of participants that make them feel less than or unworthy, or that their dignity is not being respected. In a similar way, we can move away from autonomy and do just the opposite, which is coercion. And in a coercive relationship, again, that can be subtle or overt as well. And what happens is it sends the message to participants in services that the professional that's delivering services doesn't believe in them or their ability to be an active, positive agent for change in their own lives. In that way, professionals might fall into the pitfall of imposing their own worldview about what a family should do rather than understanding where a family's at and working with them on strategies and approaches that match their own values, needs, and beliefs. Now, this final area might be a head-scratcher for some folks because we have assessment listed, and this is an overview module about 5 screening and assessment tools. So the important thing to bear in mind here is that the use of tools is not necessarily bad, but if we use the tools badly, they can send a message that's very similar to the judgment one, that we're somebody who's not coming alongside in partnership with people, willing to work with them and affirm them for their efforts, but that rather we're removed, stepping back, judging, measuring, and determining whether somebody is good enough, which is a message that we don't want to send. So in bearing these 2 MI principles in mind, both the idea about conveying acceptance and the idea of sending a message of rejection, better approach screening and assessment in a way that is supportive of people and is more motivating of their ability to make change in their own life. So why should we use motivational interviewing consistent strategies? It's not just a matter of being nice. It's really a matter of being more purposeful for the practitioner and the participant in services. It allows a professional to build rather than break trust by staying out of the judgmental position, by not taking on other people's life as if it's the responsibility of the professional to fix it, by affirming others. What we're able to do is provide an alternative to make sure that people understand that they are able to make the changes in their life and that can be done with support. We also know that when people use MI consistent strategies that they're more likely to do work with a home visitor or a parent educator or another professional that results in them making the case for change in their own life. In motivational interviewing, this is looked at as positive change talk or change talk. And what we know from the research in motivational interviewing is that change talk is associated with higher levels of making and sustaining positive behavior change. So there are some specific motivational interviewing skills that allow practitioners to navigate conversations with participants in services in a way that sticks with that spirit of acceptance. And this can be used in screening and assessment when it's being introduced and also when the outcomes of a screen or assessment are being considered and folks are making a plan. So one of those skills is asking open-ended questions. So those what or how questions that help people have some space to consider next steps and plans. Affirmations can also be very helpful in terms of recognizing and giving voice to people's strengths. Being reflective or offering reflection is also really, really important because what it does is it shares back people's important content with them and it adds an additional layer of meaning. Finally, summarizing is a really important part of the OR skill set because it allows practitioners to do a few things. One, it allows practitioners to really convey that message of empathy, that they've really understood all of the important things that a participant has shared with them. In doing that, it also opens the door for our participant in services to clarify any misunderstanding. So if something comes up in the summary and that's not quite right, it's an opportunity for a mom or a dad or a primary caregiver to say, I think you didn't quite catch this piece. It's also an opportunity to structure and transition to another part of a home visit. So by using the ORs, it allows home visitors to put aspects of motivational interviewing spirit into practice. So motivational interviewing also provides some significant guidance on how to offer information. So one of the important ways to offer information is to first evoke from the client what it is they already know about the situation or issue at hand, or what it is they already feel about the situation or issue at hand. Another strategy of how to offer information is to provide kind of a sandwich of eliciting or evoking again from the family their perspectives, their feelings, their thoughts, and then providing information, and then eliciting a response from them about what they make of the information that has been shared. Another strategy is to offer a menu of options. So if you want to offer information, you may provide 4 different options or 4 different ways of looking at something for somebody who is receiving services to consider. So that way they can determine what of those options, if any, work for them. And finally, whenever offering information, it's important to emphasize autonomy and let participants in services know that they can choose what to do with the information that's coming from screening and assessment. Whenever there are conversations about things that are important, there's always the possibility that discomfort occurs. So it's important to understand what the signs of discord are. Here are some things to look for. Defending. So when a home visitor finds themselves sharing a screening or assessment tool, or sharing the results of a screening and assessment tool with a family, and the family is in a position of justifying or explaining away the outcomes, that means that the family has likely felt like they've been put on the offense, and so they're trying to defend their position, defend their way of life, defend their values and their beliefs and their experiences. I need to pause and re-record the slide because my phone is going off. Sorry. All right. In conducting screening and assessment about sensitive topics and areas, it's not uncommon for discomfort to occur. And when discomfort occurs, it's important to know it when we see it or feel it, and to address the discomfort. Some signs of discord may include defending, squaring off, interrupting, disengagement, or our own mood and approach may be an indicator of discomfort or discord. Let's talk a little bit more about what each of these mean. When somebody feels like they're being told what to do, or they're being interpreted or defined, or somebody else is making meaning of their life that doesn't make sense, they may be pushed into a place of getting positional and wanting to defend who they are, why they do, what their values, beliefs, and practices are. When this occurs, it's really important to acknowledge that the discord has occurred and to find a way to make repair. Additionally, squaring off can be problematic, and in this sign of discord, it's clear that the home visitor or parent educator or family advocate and the family are coming from very, very different places and may also be doing some of that defending or justifying their own position or point of view rather than working together to understand the family's point of view and next steps and strategies that make sense for the family, given their own needs, values, and beliefs. Another sign is interrupting, and that can happen on the part of the home visitor interrupting the participant in services, or the family not having much interest in what's being said and interrupting and changing the subject. Disengagement is also a sure sign, and that can be disengagement in the form of withdrawal, or again disengagement in the form of trying to shift the agenda. So our own mood or approach about a particular topic can also set a tone that either creates comfort and assurance that families are participating in a meaningful process, or it can set families up to feel like what they're doing is awkward or just paperwork that needs to be handled. So one of the most significant things that home visitors, parent educators, or family advocates can do in terms of working with discomfort is to be reflective and to notice the dynamics that are occurring, not just what's being said, but how it's being said and what the atmosphere in the room is. So key to that is understanding our own triggers and understanding the triggers of the families that we're working with. So there are those moments where we have things that push our own buttons, and there are things that may push the buttons of families even when we are operating with the best intent and the best skill. And sometimes there's also those moments where our triggers and the triggers of families overlap, and that's often where the discord lies. And so in those moments it's really important to remember the key components of motivational interviewing spirit and that idea of being able to convey acceptance through that recognition of their value and worth, through that ability to provide affirmations, and through that ability to emphasize that it's their choice, that they have the control to decide what to do with the information or not. So sometimes pushback about screening and assessment is really related to people seeing screening and assessment as an interruption of home visiting services rather than a key component of it. And when we remember that screening and assessment is about collecting data, but it's more than that. It's about understanding that data is about people and their experiences. It's about people and their stories. And using screening and assessment tools about sensitive topics is a way to have a guided conversation about what's true in the lives of the families that we're working with. So the 5 screening and assessment tools that will be covered in the online modules are the Abuse Assessment Screen, the Childhood Experiences Survey, the Edinburgh Postnatal Depression Scale, the Perceived Stress Scale, and the Home Inventory. In addition to the online modules, there are some tip sheets that have been developed as well, and the tip sheets provide some summary information for home visitors and their supervisors. So each tip sheet has a section that includes quick facts about the tool. Those quick facts include who the author is, when it was published, and research related to the screening and assessment tool. The tip sheets also include the protocol, which includes the steps in which the screening and assessment is conducted, as well as information about the timelines that are required to meet benchmarks for those who are Family Foundation's home visiting grantees. Tip sheets also identify common pitfalls of using the tool, so that way people know in advance of some things to try to avoid in order to be effective. Tip sheets also have a section about what the value of the tool is to families, how it can be useful to them, not only useful to the home visitor. It also talks about how to frame the tool for families, so that way they understand the purpose of it. The tip sheets include information about how the information and conversation that happens associated with the screening and assessment can be used to strengthen home visiting services. Each tool also includes quick facts about the topics or issues that are being considered in the screen and assessment, there are some tips for supervisors as well as some reflective activities for staff. Here's an example of the abuse assessment screen. This tip sheet is available at the end of the module in the abuse assessment screen module and can be printed out in advance and used as a handy desk reference. The tip sheets are about 3 pages long each. There's also a tip sheet for the Childhood Experiences Survey, a tip sheet for the Edinburgh Postnatal Depression Scale, as well as a tip sheet for the Home Observation for Measurement of the Environment, or Home Inventory 0 to 3, and the Perceived Stress Scale. In addition to all of those screening and assessment tip sheets, there's also an action plan for frontline staff to consider each of the tools and to consider whether it's something that they're still learning to use with families, whether it's something that they can use with some limited support, whether it's something that they feel like they're using well, or it's something that they do well and can teach others to do. There's also an opportunity to make note of next steps or opportunities to strengthen how the screen or assessment is used. In addition to the action plan for home visitors, there's also an action plan available for supervisors that allows supervisors and home visiting frontline staff to compare their responses to where the supervisor thinks the frontline staff member is at and where the frontline staff person finds himself. So by reviewing together and having that open dialogue, it allows both the home visitor and the supervisor to see if there's any additional professional development that would be interesting or necessary, to see if any of the reflective activities suggested or ones that they come up with together may be useful in using the screening and assessment tool, to see what the outcome was for particular families, and to do a data review to make sure that the needs of the individuals as well as the needs of the community are being met. For information about the online modules or about this overview, please feel free to contact Lily Irvin Vitella at commonworth.net. At the end of this module, which you've now reached, you'll be able to see several handouts. There are handouts of the tip sheets as well as handouts of Motivational Interviewing Promises by Paul Burke. And that handout allows you to think more about motivational interviewing spirit and what kind of promises you want to be making to the families that you work with to conduct screening and assessment.